Salams and welcome. Some fabulous news for those of you who got heart problems or family of you who got heart problems. There's major advances in bypass surgery. This is from an university in Austria, the Innsbruck Medical Institute. And I will just keep this discussion very briefly because my philosophy is back to basics. So don't worry too much about this diagram. It may look a bit complicated, but don't worry. This is basically the anatomical diagram of the heart. The blue areas means where we have two types of blood. When you're breathing in, the body needs oxygen. Without oxygen, you cannot survive. So the body delivers the oxygen to the tissues, and the oxygen comes back from the inferior vena cava, from the rest of the body, and the superior vena cava from the head and neck. The blood, the deoxygenated blood, is referred to as blue. That comes into the right ventricle, right atrium. From the right atrium goes to the right ventricle. The heart pumps it. It goes to the lungs. It goes to the lungs to pick up oxygen. The CO2 is blown out. You blow out the CO2. You breathe in the oxygen. The oxygenated blood then comes back into the heart. It comes to the left atrium. From the left atrium goes to the left ventricle, and the left ventricle very powerfully pumps. It hits it very hard. It's got to pump very hard because that blood must shoot now to the brain, everything from the head and neck, the coronary arteries, jugular veins, go to the head, circle of Willis, and must go throughout the whole body up to the tip of your toes. That's how powerful the heart is. Imagine 100,000 times a day it's beating. 100,000 times a day. We take it for granted. But the Creator, Supreme God, most merciful, has given us this amazing pump. And Professor Chris Barnard famously said, there's a pump. It's just a not pump. It's a pump. But look at it. Imagine a pump that throughout your lifetime, it pumps about 1 billion or 2 billion or 3 billion times. 72 times a minute, 100,000 times a day. Have you thanked your Creator for your heartbeat? You take 15 breaths a minute, which is about 20,000 breaths a day. But life and death are between inhalation and exhalation, but we take it for granted. So once the deoxygenated blood comes in, it shoots it out. The red is the oxygenated blood. So let's leave this complicated diagram out. These are the arteries. These are the coronary arteries. We have the right coronary artery, left coronary artery coming out from the aorta. Right? Don't worry too much about that. That's the arch of the aorta. I just want to keep it simple as to what the concept is and what is the discovery that they've made in Austria and why the medical world is so fascinated. The anterior circumflex artery, the anterior descending artery, circumflex artery, but we won't go into that. I've made a simple diagram. That entire diagram, it now looks like this. Okay, so the diagram on the right, this diagram, that's the heart, the anatomy of heart. I'm now represented by a heart that we all understand. So that's the same thing, but now I'm regarding as this heart here. So let's just see first what the discovery has been, and then I will explain this diagram here. This is known, the discovery, they're calling it the space hairdryer. It regenerates dead tissue of the heart. This is amazing. It's absolutely amazing. As a medical doctor, I can tell you this is absolutely fascinating news for those undergoing bypass surgery. Gentle shockwaves could regenerate the heart tissue of patients after bypass surgery. Bypass surgery is a huge surgery. There's 4 major arteries. You have single bypass, double bypass, triple bypass, or quadruple bypass if all 4 major arteries are involved. If all 4 major arteries of the heart are involved, is known as quadruple bypass, and I will explain to you what is the meaning of bypass. So a study of 63 people in Austria found that those given the new treatment could walk further and the heart could pump more blood after the surgery. Amazing, absolutely amazing. For the first time, we are seeing the heart muscle regenerate. It is producing new tissue. That's absolutely amazing in a clinical setting, and this is by Professor Johannes Hohlfeld from Innsbruck Medical University in Austria. So fabulous work, Austria. Well done to you guys. Keep on doing this research. I love it when scientists come up with these fabulous new developments. The human body, it's so amazing. And human beings are finding new developments all the time. Science and technology. It's a fascinating world that we are living in. Alhamdulillah. Larger trials of the device, dubbed a space dryer by researchers, are now planned to be replicated in many more patients. Every year, what is a blocked artery? Every year, more than 20 million people. It's like a warfare. Imagine a warfare where 20 million people have died. Now imagine when we see the war in the Middle East and we see the war in Ukraine. But imagine the war about the heart. 20 million people are dying every single year from heart attacks. 20 million. It's one of the biggest warfares. The other big warfare is poverty. Hundreds of millions are dying because of poverty. Poverty, imagine. So on heart attack alone, 20 million is like about 2 million a month are dying just from heart attack. This is according to the World Health Organization. The risk factors for heart attack, you know the risk factors, includes high blood pressure, alcohol, smoking, fatty foods, all of these things, being a lethargic lifestyle, sedentary lifestyle, not exercising, not watching your weight, not worrying about what you're going to eat. Maybe there's hereditary problems. Maybe your parents were obese or they had genetic problems. Maybe they got diabetes in the family or heart problems in the family. So please, my advice to all the people, if you love someone, take them for a blood test urgently today, tomorrow, whenever. Check your blood cholesterol, LDH, HDL, all the cholesterol levels. What is your level of cholesterol? Check your blood pressure. These are known as the silent killers. When you got high cholesterol, you got no warning signs until you get a heart attack. If you got high blood pressure, there's no warning until you get a heart attack. If you got high diabetes sugar, there's no warning until you get a heart attack. But when you have pain, if you have a toothache, you go running to the doctor. You have a spinal pain like me, you go running to the doctor. So pain is actually a good thing. Pain makes you run to the doctor. Right? In some cases with cancer, it's too late. By the time you have pain, the cancer is advanced, but you can also stop it. So pain is actually very good. But when you don't have pain, these are known as the silent killers. They are there like in the middle of the night in your body. The cholesterol is getting higher and higher. The blood pressure is going higher. It's affecting the brain, the arteries in your brain, the high BP, until you get a burst artery. You get a stroke, you end up in ICU. It depends if you survive or not. These are known as the silent killers. There is no cure for these silent killers unless you take precautions. The medications can just control it. It can't make it go away. So please, if you love someone, go check the cholesterol, check the diabetes, do self-examination for breast cancer. So for those you care about, please look after your body. Prevention, I always believe, my professor used to always say, prevention is better than cure. Rather solve the problem before it gets worse. Even cancer, the earlier you pick up cancer, the better it is. Drugs and other treatment can help manage the disease, but it reduces chance of heart attack where the supply of blood to the organ is suddenly blocked. In severe cases, surgeons take a healthy blood vessel from the chest, the leg or the arm and attach it to the area of the heart above and below the blocked artery, a procedure known as heart bypass, and I'll explain that briefly. But this kind of operation can only preserve heart function. It can't improve it. It won't improve it because you have dead tissue. You can't improve it. But now with this amazing discovery that dead tissue is becoming alive, it's regenerating. There's more new tissues that are coming there, like neoplastic. It's a new tissue that's developing there. So this is absolutely amazing. So I'm thoroughly happy and excited by this finding. They did a study where half of the bypass patient surgery, after a year, they had an 11% increase in their blood oxygen. It means they are able to go out for a walk with their dog again or go to the supermarket in their everyday life, and they have a longer expectancy of life. Okay, so very briefly, let us say this is your heart, this is your artery. First, let us look at this one here. In a healthy patient, this is what your artery looks like. In a baby or in a young child, the artery looks like this. There's no blockages in the artery. Okay, it's a fabulously clean artery. When you're born, you're given a fabulously clean artery. Everything's going well. The blood is shooting nicely. No problems here. As you grow older, as you are eating different types of food, okay, you start getting these yellow parts are called cholesterol, lumps of fatty parts in this lining of the arteries. Okay, they start building up. They start small initially. Now the blood no longer goes straight. It no longer goes straight. Now the blood goes in a crooked way. It goes up, down, up, down, up, down until it gets through the body. But there's no problem. But these narrow areas can cause a problem. Because remember, the body is forming clots all the time. Sometimes you're sitting for a long time, you had a clot in your legs. This clot shoots up, it comes through, but then when it gets to the lung destroys the clot. It smashes it up. But sometimes the clot is a bit big. When the clot is a bit big, it gets jammed. When it gets stuck here, you get a heart attack. It can get stuck in three places. If it gets stuck in the heart, it's known as a heart attack. If it gets stuck in the brain, it's known as a brain attack. We call it a stroke. And it can be stuck in the lungs, which is known as a pulmonary embolus. Okay, so it can get stuck in three places, and all those three places are serious. Life and death. Heart attack, brain attack, which is stroke, or lung attack, which is a pulmonary embolus, and the most severe time is called a saddle embolus, which is a huge clot which blocks both of arteries, and you can collapse. The patient can collapse with severe pain. So what is a bypass? This is a heart. So here's an artery that's coming, and the blood is going through from one side and is coming out to the other side. Okay, I'm not talking about the anterior circumflex, the aorta. I'm just make it very simple. Blood is coming in, blood is going out. But now you suddenly have a big clot. This is a big clot. So this blood, now the blood, instead of going to this particular area, it gets jammed. When the blood cannot go through, this blue areas here recall an infarct. Initially you get ischemia, less blood, which will give you angina, but you got an infarct. An infarct means the tissue is dead. The heart muscle, a small area of the heart muscle becomes dead. That means the heart is no longer a normal heart. That person will now become weak. You won't be able to do exercise again. You walk for a short while, you get tired, you become breathless because part of your heart muscle is now dead. Then in situations where you can do a stent, in that case they put a spring in here to open the vessels up, to put a stent to open the artery again. And in some cases where a stent cannot work, then they take a vessel from your chest or your leg and they make it a bypass. Bypass means here's your original artery. Bypass means they take a new vessel. They take a new vessel, a vein or an artery, and wherever the blockage is, they make a hole here. They connect this part of the tissue. That means you're going to avoid this blockage. You're going over it like a bridge, a bypass bridge, and then you join it to this part because the rest of the artery is fine. It's only this part there was a block. So then you're bypassing that blockage. And the blood now goes, instead of the blood being blocked here, the blood now goes from here, it goes up here, it goes round, it comes down and it continues like that. That's known as bypass. Some people have a triple bypass, some people have a quadruple bypass. But you must remember, when this heart muscle is dead, it's dead, it's gone, your heart function is bad. Now the fabulous news from this university in Austria means that this dead muscle with this amazing shock waves that they produce, this dead muscle, there's new arteries that are growing in that area, and that dead muscle is becoming alive again. So that instead of being a weak person, instead of your heart muscle being dead, the tissues are becoming alive again. The person is becoming strong. You can start doing exercise again. You can start taking your dog for a walk. You can go for exercise to the gym. Everything is improving for these people. So it's an amazing discovery. So give thanks to your Creator, Allah subhanahu wa ta'ala, for God most merciful, for giving us this amazing organ, the wonderful heart, the wonderful brain, the wonderful lungs. 100,000 times a day it's beating. Tutuf, 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 without stopping. Tutuf, 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 tutuf. 100,000 times a day. 72 times a minute. And you're breathing 15 breaths a minute. 20,000 times a day you are breathing in. We don't even know it. We don't even know how the heart is beating. We don't even know how the lungs are breathing in air. Give thanks to the Creator most merciful for giving us this amazing organ, the human heart. But we know there's two parts to the heart, the human heart, the anatomical heart, the physiological heart, and we have the spiritual heart. And we make zikr. Zikr is polish for the heart. Remember God Almighty all the time. Zikr is polish for the heart. Give me your thoughts. Subscribe, share, stay well, look after your heart. If you love that person, check your cholesterol. It's just a pinprick. They take a blood sample from there. Look at this. I don't know what's happened to my hand. Yeah, I got marks on my hand, but don't worry about these stains. So take a blood sample from there, send it for cholesterol test, and see what is going on. Stay well, look after yourself, look after your heart. You only got one life to live. If you care about someone, look after the heart.